Welcome to Deeper. This is a 30-minute conversation on all things sex, brought to you by Adam and Eve. I'm Doctor Jenni Skyler. I am Adam and Eve's resident sexologist. I'm also a licensed marriage and family therapist and certified sex therapist. So September is back to school month, and we are going to talk about all the sex facts you actually never learned. Maybe you didn't learn much anyway, because school doesn't always do the best job of teaching us about sex. The whole package, all about human sexuality and all the things that really help you have an awesome sex life. So in this 30-minute conversation, we're going to pick and choose some fun facts to teach you. And if you have questions and my question reader doesn't go too fast, I will try to answer them as we go. If I don't, at the end of the show, we'll also try to get those questions answered. Okay, let's start with my absolute favorite book for all things sex in terms of human sexuality, sex facts, everything. This is by a colleague of mine. This is called The Guide to Getting It On by Paul Joannides. He is a wonderful, brilliant sex researcher, and this book is the only book. If you only read one book, read this book. This book is key to learning everything. Yes, it looks thick, but this man is brilliant and witty, and everything in this book is very funny. So you can learn all your sex facts in a really funny way. So I just wanted to give that shout out to him. A lot of my understanding of sexuality does come from him and this book. So I just wanted to shout that out. Okay, let's get started. Sex facts you never learn. And if you have questions, let me just see that lots of questions coming. We'll get them answered. All right, let's talk about pubic hair. Should we just start there with pubic hair? One of the things that's really interesting around porn these days is that most of the porn actresses and actors don't have much to any pubic hair. And it's a social construction in terms of why this is so, because if you actually look at it biologically, pubic hair is kind of essential for our human beingness. Why is that? The pubic hair traps bacteria and actually prevents and can reduce, maybe not fully prevent, you still want to use your condoms, but it can reduce the chance of transmitting and receiving an STD or an STI, a sexually transmitted infection. So that's really key to having some pubic hair and catching some of that bacteria. I don't know if anyone's ever read The Joy of Sex by Alex Comfort back in the 70s, but this is one of the first sex education books, well before Paul wrote his. That was my first book that I read around human sexuality, and all the pictures in the 70s are of these women and men with these long, luscious pubic hairs and even armpit hair. And so then we took a 180 degrees trip and shaved it all off. And if that's your personal preference, no problem. But please know that there is a biological function to it. So if you do enjoy your pubic hair or you enjoy your partner's pubic hair, hey, there's some biological validity to keeping it. Especially if you are not in a primary relationship and you're kind of test driving a number of cars, so to speak, and you want to prevent one more layer, one more barrier to getting those STIs. It's interesting because when you do have sex education, maybe in middle school, if you got it in middle school, they talk mostly about STD prevention and pregnancy prevention. But they don't talk about all the reasons of, why and how to cultivate pleasure and intimacy and consent. So we do want to talk about those things too. Okay, let's see. Let's talk about orgasms. Did you know that 30% of men have faked an orgasm at some point in their lives? That's pretty surprising. Usually women get charged with faking an orgasm, and let's admit it, ladies, most of us at some point have faked an orgasm. That number is way higher. But for men, there are also some fake orgasms happening, according to a study in New York City. And let's talk about why. Why would somebody fake an orgasm? Part of the reason that I understand people to fake an orgasm is because there's so much pressure to perform. There isn't a lot of permission to be authentic in your sexual experience, to be authentic in your arousal, and to let the organic experience present itself. And maybe you're not going to have an orgasm. That's okay. Can you just sink into the pleasure and go for the ride, whether it's your own hand, somebody else's hand, a toy, a tongue, a penis, a dildo, anything, whatever kind of experience you're having, can you just sink into the pleasure of it without worrying about the performance? Because if we worry about the performance, we're worried about getting there. We're worried about getting to that destination and that goal. And if we're worried about getting to a goal, this is what happens to our bodies. I gotta get to my goal. And this is not relaxed enjoyment of pleasure. This is, I'm getting there, and I hope this happens, and I hope my penis looks big enough, and I hope I don't come too quickly, and I hope this penetration isn't painful, and I hope I have that orgasm, and I hope I don't look so silly, or I hope I look okay enough, and I'm going to watch myself having this orgasm, and I'm going to watch myself from the corner of my bedroom while I'm having sex because I'm worried about my body. These are such common narratives. This is how we typically have sex. We're worried about our performance of it. And then we go like this, because who likes to be on stage and give a public talk? Well, I kind of like to do that. But typically, and I get a little nervous, but when we do have public speaking opportunities, we get nervous and we do this, and this way of having sex is not enjoying the journey and the pleasure. So then we don't get to our goal, and we fake it. And that's a shame, because we don't want to fake our pleasure. We want to experience it as it organically presents itself. And sometimes it's going to be a pleasure of, just a little bit. And sometimes it's medium pleasure. And sometimes it's lots and lots of pleasure. And we have to allow it to have its own organic experience without squishing it out with our anxiety. So here's your invitation. If you have faked an orgasm, 1, you're normal. Most of us have. Doesn't matter what set of genitals you have. Most of us have. 2, if you have faked an orgasm, can you give yourself permission not to be in the performance of sex, but to be in the pleasure of sex? To surrender, to relax, to take some deep breaths, to move your body, to circulate your energy, circulate your blood flow, circulate your pleasure. So, let's keep talking orgasms since we're on that. Orgasms. Using lube increases your chance of orgasm. Let's talk about why. I'm not just going to give you facts, I'm going to tell you the why, because, why not? Don't you want to know why things happen? Why does lube increase your chance of orgasm? For one reason, it really reduces any chance of friction. Even if there is, so let's talk about different orifices that self-lubricate. Mouth has saliva, so there's some lubrication happening. A vagina typically self-lubricates, but not always. I'm going to come back to that. And an anus never self-lubricates. Anus always needs lubricant, period. And since this is the Adam and Eve channel, go to their website and find all their awesome anal lube. And other lubes. They have a whole plethora of lubes. I didn't bring them on the show this time, but I'll show them to you next time. We air this show every 2 weeks, so we'll bring lube next time. So now let's talk about the vagina and the mouth, which can be more self-lubricating, but not always, right? We can feel lots of arousal and desire in our biggest sex organ, which is between our ears, our brain, biggest sex organ, and we might not feel that congruently in our genitals. So lube saves us from that. If you're not feeling any desire or arousal and you just put on the lube to kind of endure sex and be like, oh, gotta get through this ride, please do not use the lube. Please just say no to the experience. The lube is your best friend and a supportive accessory if you already have some arousal, but your body's just not giving you enough of that natural lubricant. Now, why might we not have enough natural lubricant? Not necessarily because we're unaroused. We cannot have enough natural lubricant because, 1, you could live in sunny Colorado like I do, and it's kind of dry. And if you are also one of our marijuana users here in Colorado, you might get cotton mouth and be even drier. So saliva might not be working for you if you're using your mouth as one of your fun tools. If your vagina is also, maybe you're dry, again, if you're not hydrated enough, you're not going to lubricate enough. Your skin is a good indicator of how lubricated and how hydrated you are. So you want to make sure you're drinking lots of water. And if it's a drier climate, or it's that time of the month where sometimes in the cycle we're just drier, our hormones as a woman shift over our cycle, and sometimes we can self-lubricate fabulously and sometimes we can't, and sometimes we never can. And if you're a woman who's already hit menopause, forget about it. Forget about it. You don't have the estrogen anymore for self-lubrication. Well, you do a little bit, but not really. So no problem. That's why there are so many wonderful lubes out there to use. And there's little estrogen pills that you can insert into your vagina should you want a little hormone support. Pros and cons to all of these. It's your choice, your personal right. Do what you want with it. These are just invitations and suggestions to think about. But does it increase your chance of orgasm using lube? Yes. Yes, because guess what you don't have to worry about? My performance of sex. Am I going to lubricate enough? I hope I get lubricated enough. That is not relaxing and allowing the lubrication to flow. But that's okay, because if you're like, I've got this awesome lube by my bedside because it's my best friend and I just kind of keep it there because that's where it belongs, we're in good shape. Okay, so buy your lube, keep it by your bedside because it increases your chance of orgasm. That's the main message here. Let's keep talking orgasm while we're here. Did you know that lesbians have the most orgasms after men? This is from the Journal of Sexual Medicine. And the reason for this is that lesbian sex tends to focus on genital pleasure around the clitoris without focusing so much on penetration. So yes, there's penetration. You can penetrate with your tongue, with your fingers, with toys, with strap-ons. Absolutely, there can be penetrative sex in lesbian encounters or bisexual encounters, women to women. However, because the focus is more on clitoral stimulation and a woman knows what gets her off, and then so she knows the anatomy of the person in front of her maybe a little bit better, and it doesn't even, maybe, right? We're all a unique map of erogenous pleasure. Even if we have the same genitalia or different genitalia, we're still, as an individual and a human being, a unique map of erogenous pleasure. Keep that in mind. However, having a clitoris and knowing what to do with it, and then there's that clitoris and I kind of know what to do with it, the odds increase. Let me tell you another fact around this. Penetrative sex. About 25 to 30% of women receiving penetrative sex with a penis have an orgasm simply from the penetration alone. The other 75% of us need clitoral stimulation. Now, that clitoral stimulation can come while we're having penetrative sex. It can come before penetrative sex. It can come after penetrative sex. This clitoral stimulation just needs to happen at some point in the erotic encounter so that we can ensure our orgasm. But that is also another data point in terms of why lesbians have the most orgasms after men. Okay, let's talk about size and orgasm. Size does not matter. Now, you're going to come on, some people are going to come on and be like, yes, it does. Of course it matters. It matters. It matters because it fills me up and it goes deeper and it goes thicker and size matters. If size matters to you, okay, size matters to you. That is your unique erogenous body map and size matters to you. However, if it does matter to you and you have a partner that doesn't have the right size for you in terms of your erogenous pleasure, that is why Adam and Eve have toys of all sizes, all thickness, slender, thick, big, small. I have plenty of female patients that tell me size does matter and their men are way too big. And what happens, because the vagina is only actually 5 inches and these men are quite large, it's painful. So there are masturbation sleeves that can go on the penis shaft at the very bottom so that the woman is only taking in the first few inches of her man. So size could matter. She might want a smaller penis. If you want a bigger penis, there are bigger toys. But this is why size doesn't matter. Our bodies are unique erogenous maps, and we have the capacity for pleasure everywhere. And so if your body parts don't quite sync up, we have lots of other body parts to play with to bring pleasure to the whole body, and orgasm to the whole body. I don't know if you all remember Dr. Ruth. Dr. Ruth is one of the pioneers of sex therapy and human sexuality, and she was very famous in the 80s and 90s, giving awesome sex messages to all of us. I love her for multiple reasons. Her new documentary, Ask Dr. Ruth, recently came out. I think it's still on Hulu. Check it out. It's amazing. It talks about her start in life, and it talks about her start in sex therapy, and she's just an amazing role model. She's also 4'7". I am 4'10", so you can't tell with me sitting, but I just love that she's a small little pocket-sized person of wonderful information. So one of the things that she always used to say is size doesn't matter. Let me again reiterate why this is so, right? Because we have nerve endings all over our whole body. We have the capacity for pleasure in so many different ways, and we have so many ways and methods to have an orgasm and to have pleasure that if your size doesn't sync up, okay, let's not worry about that, because the biggest aphrodisiac is actually confidence. Confidence in yourself to connect with another person and ask the right questions to say, hey, how can I bring you pleasure? You got to ask the questions, because guess what? You're not a mind reader. Okay, motion in the ocean. You got fingers, tongues, toys, and remember the lesbian piece about them having the most orgasms without a biological penis involved if it's just two women? Well, hey, size doesn't matter there either, and they're having the most orgasms. So again, I come back to size really doesn't matter. But you can still go shopping if you want. I don't have any accessories today. Next session, we're going to have lots and lots of accessories, because accessories are fun. Okay, let's keep talking about some other fun sex facts you might not have gotten. Okay, again, staying on orgasm for a moment. The average length of a female orgasm is 20 seconds. 1, 2, 3, 4, 5, 6. That's the average length of a male orgasm, about 6 seconds. Triple that. And that's the average length of a female orgasm. I mean, I'm not complaining. All right. Let's talk more about orgasms. Orgasms can happen in your sleep. I don't know who's watching here. Have you ever had an orgasm in your sleep? Oftentimes they happen in your sleep if you're not having enough orgasms while you're not sleeping. For men, especially when they're age 12 to 21, if they're not having enough orgasms through solo sex or through partner sex, they're going to have an orgasm called a nocturnal emission in their sleep. Actually, you might not have the orgasm and ejaculation tend to be paired together as one experience, but they're actually separate clinical events that tend to be overlaid together. So a nocturnal emission could happen in your sleep, where the semen comes out of your penis into your sheets, into your boxers, or whatever you're wearing in the middle of the night, and you might not actually feel the orgasmic benefit of that. Now, if you do feel the orgasmic benefit of it, awesome. And if you have ruined your sheets or your boxers, do some laundry and don't stress. Now, if you're 12 to 21 and you feel embarrassed by this, that's understandable. But again, you know what? Just do some laundry and again, give yourself permission. Hey, this happens. Other orgasms for women happen in their sleep without sort of that nocturnal emission piece. And they can have multiple orgasms in their sleep. And again, usually that's because solo sex or partner sex not happening enough in real time or in real waking life, and so it happens in your sleep. Because our bodies are designed for pleasure. It's one of our biological functions. We would not have orgasms in our sleep if our bodies were not designed for pleasure. Period. I don't know what kind of studies they have on animals and if they have orgasms in their sleep or not. That would be a very cool study. Actually, I'm going to go look that up after this show. But our bodies are completely designed for pleasure. Are they designed for procreation as well? Well, yes, because we procreate, but we have way more sex than we do for procreation. So most of us procreate, if you procreate, if you procreate, then you tend to procreate anywhere from 1 time to 3 or 4 times for most average families. If you live in a different country, or maybe even this country, and you're like bigger families and you have the space to have a bigger family, still families don't usually exceed 10 to 13 kids. That's a lot of kids, but hey, your choice, have a good time. Still, those families, let's say you have 13 kids, you're gonna have sex way more than 13 times, because the rest of the sex you're having is for pleasure. And all of our parts, from head to toe, have the capacity for pleasure. I don't remember if I mentioned this in a different episode, but I have a wheelchair user. One of my patients is a wheelchair user and doesn't have sensation from the waist down due to his injury, and he has redirected his orgasm to his neck. His neck is super sensitive, super electric, and he has these electric experiences through his neck because the nerve endings can be rewired to the places of the body that do have sensation, because our bodies are resilient and amazing and designed for pleasure. So if you have these wonderful, delicious orgasms in the middle of your sleep, good for you. Enjoy them, and then be like, well, maybe a little more solo sex needs to happen for me during waking life too. It's just a little sign to be like, hey, it's kind of like dreams. Some of our dreams are like, hey, remember this issue that you haven't worked out? I'm going to show up in your dream so that you can be reminded to work this out. My dead mother sometimes still shows up in my dreams, because you know what? Sometimes we got to keep working these things out. Okay. Let's see, what else should we talk about? Not my dead mother. Let's talk about fun sex things. Any orgasm? Oh, let's talk about why orgasms are so beneficial for our health. Whether you have them in your sleep or you have them in waking life, we have so many health benefits that happen from an orgasm. Mostly because there is this release. There's a physiological release of like, I had an orgasm, but there's also a release around a cocktail of hormones. So this cocktail of chemicals that gets released include, let's talk about for men. For men, you get norepinephrine, serotonin, the happy one, oxytocin, the bonding one, vasopressin, and nitric oxide. So there's this cocktail of chemicals that gets released, and it's like, how lovely, how delicious. For women, similar stuff. Oxytocin and dopamine are the primary chemicals. And two things in terms of why these chemicals being released are so key. 3 things. I'm going to add a few more in there. 1, it actually has been shown in research to have protective qualities against cancer. So you release these hormones, you can actually have a preventive quality against cancer. I'm going to come back to this in a little bit. It also wipes out cortisol. Cortisol is a stress hormone. It's what makes us do this. And we get stressed. We all know this feeling. So an orgasm wipes out the cortisol by having these other hormones, the oxytocin, the dopamine, the norepinephrine, wash it away. Wash it away, and we feel reset, and we feel rejuvenated, and we feel relaxed. All of those pieces are key to our human experience in terms of feeling connected to another person, connected to ourselves, and actually having arousal again, because it's part of the human sexual response. Let's talk about why it might wipe out cancer. There's actually some studies around having an orgasm, having ejaculation actually for a man, where the more ejaculation you have in a month, about 21 times per month is what the research shows from a Harvard study, and it's showing to reduce your chance of prostate cancer. Why? Versus, let's say you have 21 ejaculations a month versus 4 ejaculations per month. The 21 per month has a higher chance of cleaning out the prostate, cleaning out any substances that just might be harmful that we've collected and stored in our body. So that's what the research is showing in terms of their hypothesis of cleaning out the prostate, having more of a detoxifying and cleansing effect, so that you might reduce your chance of cancer. This is all to say that you should be having more orgasms, because why not? It's good for our health. Decreases the cancer, maybe, hopefully, wipes out the cortisol, helps you feel connected, helps you feel relaxed to go to sleep. All these are awesome health benefits to orgasm. You can have an orgasm with a toy, with a tongue, with a finger, with a penis, with a strap-on. You can have an orgasm through your nipples. Some women have orgasms through their nipples. I know a woman who has an orgasm through her nipples in like 20 seconds max. It's like immediate. So we all have the capacity to have orgasms in different parts of our body. And you might not feel it as a rhythmic contraction of the genitals, which is our typical definition of an orgasm. You might feel it as this peak climatic experience of like, I'm on fire, this is electric, and I am in bliss land. That's another way to define the orgasm subjectively in your own body. So could it be the rhythmic contraction of the genitals? Yes. Could it be something a little bit different in terms of a peak climatic experience? Maybe it's a heart experience with somebody else, and you're like, I feel so ridiculously connected to you right now, or I feel really connected to nature or spirit. That can also be a different kind of orgasm. So open your possibilities to what kinds of peak climatic experiences you can have. Let's see if there's anything more on orgasm. Let's talk about transgender people and orgasm. So I was reading some studies that most transgender people who undergo sex reassignment surgery, so you're going to change the genitals, and sometimes there is a concern if the genitals have surgery and get changed, do I retain all my nerve endings and all the yummy, delicious parts of my pleasure in the genitals, even if I'm reconstructing what the genitals look like? Yes, the answer is yes. 85% to 100% of transgender people still can retain their orgasmic capacity in their genitals. Good. All humans deserve to have an orgasm. That's actually our birthright. Any other pieces on this? Okay, I'm going to leave you with this fun fact. Most favorite celebrities that we fantasize about during sex. So if you're struggling to get to that orgasm and you need a little fantasy help, which sometimes we do, that's also really normal. Most of us, like 50% of us, maybe more, I'm going to guess more, have thought about somebody else while we are with whoever is in front of us. We have been known to think about somebody else while we're in connection with that person in front of us. Don't feel so guilty. It happens. That's okay. That's the whole point around fantasy. Now, if every single time you're connecting with your primary partner, you're thinking about someone else, maybe you want to do a little exploration around what's happening in the relationship, or what's blocking you from feeling safe to feel vulnerable. But in the meantime, if you need fantasy help and you're part of this study where these are the favorite celebrities, most people, or at least what this research study showed, that they get fantasized about. So the men that get fantasized about most are Brad Pitt, Johnny Depp, Chris Hemsworth, Tom Cruise, and Chris Pratt. I think I've only tried on Johnny Depp of that list. Of the women, Jennifer Lawrence, Kim Kardashian, Taylor Swift, and Kylie Jenner. Those women don't make my list, but they might make your list. So here's your question. Here's my question to you, and you can answer it later, or you can comment here on Deeper. Who have you thought about as a famous celebrity in Hollywood? Or maybe in politics? That is your fun question of the week, and we're going to catch you in 2 weeks. We'll catch you on the next Deeper episode with more fun facts that you might not have learned, going back to sex school to, again, optimize your pleasure and your sexual experience, fun facts that you might not have ever learned. And if you are a sex nerd and want to learn so much more, Dr. Paul's book, love it. It's a great resource for all things. You will be super knowledgeable after reading that. You could read it If you're partnered, you can read it out loud to each other. Just read a small little chapter a night. Super easy to do, super funny. Or read it alone, or just keep it as a coffee table book. And when you have parties, you can all read it together. Just another way to interact with your sexuality. All right, we're going to catch you in 2 weeks here on our deeper episode. Again, 12 p.m. Eastern Standard Time on Instagram Live TV on Fridays every other week. And if you don't know and you have only a short amount of time, we have Savvy Sex in 60 Seconds, which is our short little clip every single week around some sex fact regarding, well, the theme of the month. And it's back to school, so check out our Savvy Sex. Find out those sex facts that you never, well, maybe you learned them, maybe you didn't. That's okay. It could be a good review or something new, and we'll see you next time. If you have any questions left over, please ask our Adam and Eve team. They're super knowledgeable. And I will catch you in 2 weeks. Have a good weekend.